Welcome to your Barbados Today Evening News Update for Tuesday, April 7th. Health authorities assure Barbadians there is no need to panic as the country records its third death from COVID-19. In the wee hours of this morning, another elderly male aged 95 died. This follows the passing of the first patient, an 81-year-old male last Sunday, and a 74-year-old man yesterday. Head of Infectious Diseases at the Queen Elizabeth Hospital, Dr. Corey Ford, expressed regret at the death, but noted that the elderly is most at risk of dying from the virus.
If we look at the data internationally, it's quite clear. Persons who are above the age of 60 and certainly above the age of 65 are at increased risk of death when they contract COVID. This is then complicated by the fact that we also know that people with hypertension, people with diabetes, people with cancers, as one of these patients would have had, these persons and the immunosuppressed individuals, these individuals are in increased risk of getting complications and death associated with COVID disease. If we then look at the other end of the spectrum, we know from all the international data, both from China and information coming out from Italy, that persons of the younger age group, certainly below the age of 19 years of age, that the sort of complications that are seen are much less. It doesn't mean that there have not been deaths identified in that area, but certainly the percentage of individuals who present with severe disease in that age group has been quite less, and that's really followed in our trend in terms of our presentation. So I think in the current trend of things, we are following quite well within the international parameters. But to say that, because we know this, I think a few key things have been put in place to try to decrease the risk of the impact in the elderly population, even before we identified the case in Barbados.
COVID-19 cases in Barbados moved to 63 today. Dr. Ford, who is also the isolation facilities manager, reported that 53 people remain in isolation.
We expect 3 further admissions today from our cases identified last night. At the Paragon Isolation Center, we have 17 persons, of which there are 8 females and 9 males, and they're all stable. Quite good for us is that we have 2 of these individuals screening negative on their screens as of last night. They require now 1 more screen of negativity for release from isolation. At our second campus, at our Enmore facility, we have 3 patients who are currently ventilated. All 3 of them are critically ill at this point, with 1 male, a 52-year-old male, remaining extremely ill at this point, and his situation is complicated by diabetes. At our third campus, our Blackman and Gollop isolation facility, we have 29 patients. There are 16 females and 13 males. 4 of these individuals remain in our more high dependency area, and all of them range, their age ranges there are between 60 and 80 years of age.
On this World Health Day, President of the Barbados Nurses Association, Joanna Waterman, urges authorities to do more to ensure the full protection of nurses and other frontline workers at this critical time. Noting that the special day comes at the height of the COVID-19 pandemic, she said the importance of nurses must not be taken for granted, and therefore they deserve all that is needed to ensure they can perform their duties safely.
We urge management and the authorities now to make it mandatory for all nurses in the emergency room to don PPEs and mandatory testing for nurses who are found to have been exposed to positive patients revealed after the fact. This is actually in light of the fact that COVID-19 patients are reaching the emergency room unknown to nurses and medical personnel. Such a protocol was implemented during the HIV/AIDS pandemic regarding needle sticks, so this, of course, would not be a precedent. The situation is fluid and therefore likely to spread to geriatric and psychiatric healthcare institutions, and we need to bear this in mind. The same mandatory policies will therefore need to be implemented for our nurses who care for such patients in these institutions as well.
Starting tomorrow, Barbadians in urgent need will be able to order and collect groceries but not shop at supermarkets during the 24-hour curfew. Acting Prime Minister Cynthia Bradshaw this morning outlined several new arrangements, even as she urged Barbadians who were already stocked to stand down from grocery shopping at this time. She made it clear the measures will not only prevent the chaos chaos witnessed at supermarkets last week, but are in line with public health guidelines to stop the spread of COVID-19.
Orders will be taken by the individual participating supermarkets via websites, telephone call-ins, WhatsApps, or email. Payments for these orders will be accepted through cash, debit, or credit cards. All persons ordering groceries in this manner will have the option to collect their groceries in person through curbside vehicle pickup or home delivery. Where shoppers choose to pick up their orders in person, they will be given specific collection times to reduce the risk of large gatherings that would contravene the requirement for physical distancing.
Bradshaw also announced that a special regime to facilitate people who cannot conduct online ordering is also to take effect at 5 supermarkets.
They will be able to go to Chanel's, Trimart, Popular, Savings Mart, and Jordan's to pay for and collect pre-packaged baskets that would have been already prepared by the operators. Shoppers will be able to see a list of items in each basket ahead of placing and paying for their orders on site. These baskets will be in values of $25, $50, $100, up to $150, with the contents determined by the individual retailers based on their examination of the shopping patterns of their customers. All shoppers, when placing walk-up orders for the prepackaged baskets or collecting telephone or online orders, will be required to observe physical distancing rules of a minimum of 6 feet behind the person in front of them.
There's regional and international news after this short break.
Barbados Today, news you can trust.
Welcome back to Regional Developments. Antigua and Barbuda's Chief Medical Officer, Dr. Rhonda Silly Thomas, today confirmed that St. John's recorded its first COVID-19 death. The victim is said to be a 48-year-old male who was admitted to hospital on Saturday showing symptoms of the virus.
He was managed for complications of diabetes mellitus, but because of his presentation, he was also suspected of having COVID-19 disease. Samples were therefore taken and sent to the Caribbean Public Health Agency, CARFA, in Trinidad and Tobago. The patient's immediate management at that time included stabilization, but despite medical intervention, the gentleman passed away in the intensive care unit, or ICU, on the same day of his admission. His results were reported to the Ministry of Health, Wellness and the Environment today as one of 17 samples that was sent to CARFA on Monday, 6th April 2020. Of the 17, 5 samples returned positive. One of these is a repeat, one is the patient who passed away, one is a healthcare worker, and the other 2 are currently hospitalized at the Mount St. John's Medical Center. So far, there have been 55 persons in Antigua and Barbuda who have been tested for COVID-19 disease. Of these, 19 have been found to be positive and 36 negative. 3 of the 19 are healthcare workers and 12 had a positive travel history.
On the international scene, British Prime Minister Boris Johnson is set to spend a second night in intensive care on Tuesday to help his fight against a coronavirus infection. His deputy says he will pull through because he's a fighter.
I can tell you he's receiving the very best care from the excellent medical team at St Thomas's Hospital. He remains stable overnight. He's receiving standard oxygen treatment and breathing without any assistance. He's not required any mechanical ventilation or non-invasive respiratory support. He remains in good spirits and in keeping with usual clinical practice, his progress continues to be monitored closely in critical care, and we'll give further updates on the PM's condition when there are any material developments. And I know that there's been groundswell of messages of support from people here at home, from leaders across the world, and I know that everyone will want to join with me in wishing the Prime Minister a very swift recovery.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.